Bedwetting is often connected with childhood, and about one quarter of children experience problems with nocturnal enuresis, or urinating while asleep. However, most children grow out of this condition when their bladders become bigger and better developed. Research shows that bedwetting occurs in 1 to 2% of adults, but these numbers may be higher sometimes. Some adults are likely embarrassed or are willing to talk to doctors about the problem.
Bedwetting, generally, what it means is nocturnal enuresis. That's bedwetting. And it's an involuntary release of urine during sleep. But when usually it happens in children, but when it starts happening in adults, it becomes of great concern. Many children bedwet when they're very young, and after the age of 3, 5, many of them stops. And the major causes of bedwetting could be genetic. Many people who have been found where both parents bedwet, we found that about 77% of the children are more likely to bedwet. Genetic means something you inherited, that you're born with. If you have a parent who was bedwetting or both parents bedwetting, then the chances that a child from that home may bedwet. But if it's just one parent, they say that the chances is about 40%.
Nocturnal enuresis is caused by imbalance in the production of antidiuretic hormone, infection of the urinary bladder, complications with the bladder, cancer of the bladder, or too small bladders, amongst other factors.
From experience, we've found out that many adults have had, because one of the causes of bedwetting is stress and anxiety. And in adulthood, when people start to bed, when people are children, they don't really care, but when they become adults, it affects them. For example, like a young lady who is bedwetting, it will be very difficult for her to have a companion at night because she will be very embarrassed. She will not want to keep a friend overnight, or she want to go and sleep over in somebody's house. She feels very, very embarrassed because maybe during the course of the night, she has to bedwet her boyfriend's bed. So people are very, very particular about it, and it has really, really affected some. Adult bedwetting can be cured depending on the underlying cause. Once you go to see your doctor will be able to know the cause, whether it's a blockage, whether it's a bladder control problem, whether it's a prostate problem, whether it's a vaginal prolapse, whether it's urinary tract infection, and what have you.
There are several ways to prevent adult bedwetting in the society, which include monitor fluid intake, setting limits for evening consumption, use of antibiotics to treat urinary tract infections, amidst other factors.
We have treatment for bedwetting, and one of the first things we have to do is to counsel the patient. You have to do lifestyle modification. You want to know how is this feeding habit for this patient is. Do this patient eat very late? Do you have irregular meals? So you may now stop the patient from eating at a particular time so they don't drink over. But when they have underlying problems, you need to find out what are the underlying problems. Sometimes we have to give medication. If we do find out what is the underlying problems, then sometimes they go to another level by getting surgery. If you cannot use only medications, there are some other modification like you may now get a mattress cover for the patient. You may get a vibrator that can be attached to the underwear. They could have a clock, you could have an alarm that will wake up the patient at a particular time.
Nocturnal enuresis is not a condition that society should ignore, and more attention should be paid to it. It is important for communities and individuals to work together to address the stigmas of people with a health experience, not only to protect them, but also to save lives.